think stigma is a massive issue in mental health, and it's a very complex issue actually, and I don't think there are easy solutions, easy answers. Why are mental health conditions stigmatized? I think it is a really complex and difficult question. I think our hope at the MRC Centre is that one of the things that may reduce stigma in the long term is as we understand more about these conditions. There's a real belief, I think, that as the biological factors are more understood, as the reality of these disorders as real illnesses becomes clearer, that may impact on the stigma of a condition. But I think that's something that isn't in a very, that may be quite a simplistic way of thinking about things, because certainly the conditions that we study can be really, really serious, can be severe, can be appalling to live with, and can be difficult for those people around them dealing with those illnesses. So I would hope that the work that we're doing goes some way to reducing stigma, but I recognise that is an aspiration, and that is a complex situation that we're working in here. And I think it comes back to the stigma question as well, doesn't it? I read Ian McEwan's latest novel, Sweet Tooth, on holiday last summer. Quite near the beginning, there's a paragraph, at the start of one of the chapters that talks about, because it's a book set in the early 70s, and one of the characters gets cancer, and there's a paragraph that describes cancer in the early 70s as being a moral deficiency, something that people wouldn't use the word for, something that tainted people with a sense of responsibility. And I was reading that thinking, actually, this is what it was like in cancer 30, 40 years ago. This is exactly what it's like for mental illness now. This isn't what it's like for cancer now. And one of the reasons why that is that there's been such advances in our understanding of cancer and in people's perceptions of what it means to have cancer. Cancer is not a death sentence anymore. It's science has really made some great progress in that. And I guess what I would argue is that if we throw the same resources into solving some of these issues in mental illness, if we spent the same money on research in mental illness as we did in cancer, then in 40 years' time, people may be reading accounts of stigma and not understanding how that can be for mental illness in the same ways that we now read that book and can't understand how that could possibly, how could a diagnosis of cancer have that moral tinge that people that it had some blame attached, that it was something that people were ashamed of. We just can't understand that now, because our concept of cancer has changed massively. One of the key reasons, I think, for that is the research that's been done. I guess one of the things that we would argue in the centre here is that we need the same effort around the world. We need the same huge amount of investment that's been made in trying to solve the issues of cancer for mental health, and maybe in 40 years, the similar improvements will have been made.